So I really want to talk about health. Health essentially. Have you ever thought about what makes you healthy? What really is health? So health essentially is not the mere absence of disease, but rather a continuum that exists between extreme illness and optimal wellness. This continuum is influenced by multiple interconnected factors. We'll be discussing just three: nutrition, social interaction, and then anthropogenic toxicants. Good nutrition provides the essential building blocks for growth, for repair, for immunity, for energy and balance. And anytime you tend or you eat good food or good nutritious food, you tend to move towards health essentially. So if we say health is a continuum that exists between extreme illness and then optimal wellness, anytime you eat good food, you tend to essentially move towards health, right? Now, let's flip the script and you see. So when you expose yourself or you consume food that is not good, you predispose yourself to, chronic diseases like diabetes, like cardiovascular diseases, obesity, micronutrient deficiencies, thereby tilting towards illness, right? So social interaction. Human beings are inherently social, and the quality of our social interaction has profound effects on health. Let's look at it this way. Supportive relationship essentially foster psychological stability and wellness. You know, reduce your stress and then improve your total well-being. But when you flip the script and you are in a toxic relationship or maybe experiencing social isolation or stigmatization, they tend to exacerbate your stress level, reduce your immune system, and expose you to increase, susceptibility to psychological, mental, even physical illnesses. You see, now let's talk about anthropogenic toxicants. Modern industrializations and human activities expose or release a whole lot of anthropogenic toxicants into the environment. We talk about pesticides, heavy metals, plastics. They all contribute to destabilizing your health, especially when you are exposed to them for a very long time. They are the primary cause of your endocrine disorder, primary cause of reproductive problem, primary cause of respiratory problem, primary cause of, physiological system disorder essentially. So you can see that health is not merely the absence of disease, but rather a dynamic equilibrium that is shaped by the food we consume, the quality of our social interactions, and then we talk about the anthropogenic toxicant we are exposed to essentially. If you truly want to promote your health, then you should think of improving your nutrition, increasing your positive social ties and limiting exposure to anthropogenic toxins. And to me, that's what health means. But if you think otherwise, let me hear your own idea. Thank you.